Good morning. I welcome you both to the Valder Beebe Show. Thank you for being here as I talk to my audience live over multiple platforms. And Dr. Browning and Leona, I can't say the whole thing, so I'm going to call you Leo. I was wondering, Dr. Browning, I understand that you have children who are impacted by eczema. So do I. So that made me wanted to really talk with you. What are some of the biggest challenges that people living with this condition face?
Well, as a pediatric dermatologist, as well as a parent of two teens with eczema who developed it when they were infants, I can tell you that it's very frustrating. You know that. And the dryness, the redness, the cracked skin, and the unrelenting nature of eczema can be really quite frustrating. I think many of us tried things in the past that may not have worked or may have not worked that well. Eczema is very common. It's also referred to as atopic dermatitis, by the way, in the medical world, but most people know it is eczema, and it does affect 26 million adults, or 26 million people rather, in the United States, including 9.6 million kids. And as you mentioned, we can often relate to it as having kids with it, but many of us also have adult friends or family that also suffer from eczema. It can happen at any age. And Leigh Antoinette, who's here with me now, her daughter Casey, who is 7 years old, has been my patient for many years, and they can definitely relate to that unpredictability, that frustration, the redness, the cracked skin, and really especially that horrible itch of eczema. But thankfully, there is hope. There is a new treatment available, and we're here today to talk more about it and hopefully provide some guidance for everyone.
Mm-hmm. Dr. Browning, I want to ask you one more question. We comfortably call this eczema, and you called it by its formal name, atopic dermatitis. Can you kind of just give me a little bit more of what that really is? Because I find out that when people find out the formal name of something, they're more on alert. They go like, oh, I got that. People have gotten very comfortable calling it type 2 diabetes. But when you call it by its real name, they're concerned. So tell me what atopic dermatitis really is.
Yeah, so that term atopic dermatitis, it was given to describe eczema, which really happens out of place from an area of contact. So contact dermatitis would be classically from poison ivy. You get that poison ivy on your leg, you break out with the rash right there. But with eczema and atopic dermatitis, it occurs in places where you don't have contact necessarily with that allergen. So it's often involving the flexural surfaces, the arms, the backs of the legs, the neck, and the face.
Thank you so very much. Lee, can you share with how eczema has impacted your daughter? And hopefully you don't mind me calling you Lee.
Yes, absolutely. My daughter Casey is a vibrant, bright light. She loves swimming, musical theater, all the things of childhood. However, from birth to around age 5, she struggled. Her skin was dominated with redness, dryness, and that constant itching. At its heightened state, her skin was so delicate that the lightest touch would cause breaking and bleeding to occur. So as parents, her father and I had to be cautious about who could be around her. And we would later find out that Casey has multiple allergies on top of that, anywhere from food to pollen to even some of the known eczema treatments that are available for her age, as well as some home remedies that we know of. And much like Dr. Browning's children, she struggled with that constant itching. And from that itching and scratching, you compromise the integrity of the skin's protective layer. So she had to be constantly monitored. It was definitely an endless, daunting struggle for our family.
I can so identify, and you make it sound just so challenging for your daughter and for you and your husband. I'm so sorry about that. Dr. Browning, the conditions that Lee talked about, how can patients find relief for this and these skin conditions?
Yes, well, thankfully the FDA approved VTAMA tapinarof cream 1% in December 2024. This is an Organon product. That's who we're here with today. And VTAMA is the first and only steroid-free prescription cream for adults as well as kids 2 years of age and older with atopic dermatitis. It's very well tolerated, and I was an investigator in the clinical trials. Casey was one of our patients. And in the trials, VTAMA was well tolerated. The most common adverse reactions occurring in 1% or more of patients were lower and upper respiratory tract infections, folliculitis, headaches, asthma, vomiting, ear infection, pain in the extremity, and abdominal pain. But again, overall, it was well tolerated. We saw 46% of patients in the trials achieving clear or almost clear skin at 8 weeks, compared with 18% of those getting the cream alone without the active ingredient. And for more information and to learn if VTAMA cream is right, be sure to talk to your doctor and check out the website, vtama.com.
I'm going to take this one because my listening audience is on multiple platforms, and this one comes from Facebook. The poster wants to know how can they help determine, how can a cream like this, can they just try it or go through their doctor? They always are looking for an answer to their eczema.
Sure. Yeah, I can take that. Be sure to talk to your doctor, because VTAMA is a prescription product, so that's how you would obtain it, and that can be either your general practitioner, or if you have a dermatologist, of course, that'd be great to check in with them. And you can find out more information again at that website. There's patient information as well as prescription information at vtama.com, VTAMA.com.
Okay. Lee, I would love for you to wrap up with how your daughter is doing. Did you find relief? Did you use this? And how did you help her navigate these conditions?
Oh, great question. Love to help with that one. So, personally, I didn't have to use it. However, after using or trying multiple different prescription medications for her age, we were introduced to the VTAMA trials by Dr. Browning and his team, which we are very appreciative for. Since then, her skin has been a lot easier to manage in regards to eczema. And my favorite part is the quiet, the peaceful absence of not having to focus on itching 24/7, and also watching her be able to go outside and play and have adventures with her friends without having to worry about painful skin, because that was also something that she experienced as well. Now, I didn't do this alone, and I don't suggest anyone else do. So definitely talk to your doctor, talk to your dermatologist, and find a treatment that works for you and your family.
I want to thank you so much for that. Dr. Browning, as I let you guys go, where can my audience go online and find out more information about this life-changing cream?
So, Valder, be sure to refer them to vtama.com. That's VTAMA.com, where they can learn more about it, including prescription and patient information. And, of course, remind them to talk to their doctor to see if VTAMA is a good fit for them.
I think you guys have put smiles on a lot of people's faces. I want to thank you for stopping by the Valder Beebe Show and telling us, Lee, your story about your daughter, and I'm so glad it's a success story. And Dr. Browning, thank you so much for the work that you're doing. It's incredible. Have a great day.
Thanks, you too, Valder.
You too.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.